friends, and welcome in to Pediatric Flow with Jolene. I'm Jolene, and I'm a pediatric nurse practitioner, and I am so glad you're here. Today, we're going to talk about something that we see every single year, influenza or the flu. It's when the weather cools and family starts together and kids go back to school and everyone is really close together that we start to see these respiratory viruses. Today, we're going to dive into everything that you need to know about influenza in children, how it spreads, how it shows up, how long it lasts, how to care for your child at home, and when to reach out for help. So, what is influenza? Influenza is a contagious respiratory virus that affects the nose, throat, and lungs. Each year, we see two major types, influenza A and influenza B. Both can make children feel miserable and can lead to complications. So, what's the difference between influenza A and influenza B? Well, influenza A causes larger outbreaks of the flu, it mutates faster, and often is responsible for early season spikes. Influenza B circulates later in the season, and it's sometimes milder, but is still capable of causing severe illness in infants and children. Both types can cause a very high fever, cough, body aches, dehydration, and respiratory distress. So, why does the flu hit kids harder? Well, children shed the virus longer, spread it more easily, and often run really high fevers, which is scary for the child, the parent, and the caregiver. Infants under 6 months of age are at the highest risk because they cannot be vaccinated. Kids with asthma, congenital heart disease, neuromuscular disorders, prematurity, or immune compromise are at an even higher risk. So, how does the flu spread? Influenza spreads easily through respiratory droplets, touching contaminated surfaces, and close contact with individuals who have the virus. The virus can be detected up to 1 day before the symptoms develop and up to 5 to 7 days after becoming sick. The most contagious time for you and your littles is during the first 3 days of the illness. So, what are the common symptoms? What are we looking at? In children, one of the biggest symptoms is fever. It's a really high fever and can be very scary for everyone. Body aches, headaches, cough, congestion, sore throat, runny nose, fatigue, decreased appetite, vomiting, and or diarrhea. So how long does the flu last? Most children recover in 3 to 7 days. However, the fever lasts about 2 to 4 days, and that cough and fatigue that they experience, it can linger up to 2 weeks. So, when do you give something for the fever? Acetaminophen, or a brand name for that is Tylenol, is safe for most ages of children, or pretty much all ages. However, it must be dosed by weight. So that's very important to know the weight of your child and what the recommendations are. A lot of pediatrician offices and nurse practitioners will provide you a paper when you go to see them or the emergency room, which will give you the specific dose for your child when it needs to be given based on their weight. You can also look on the back of the box or on the bottle, whatever you're giving your child, if it's liquid or the chewable tablets or whatever it may be, and it can tell you based on their weight how much that they're supposed to be giving. It's important to note, however, if you have a fever in a baby under 3 months of age, do not give them Tylenol without contacting their pediatrician or your nurse practitioner or take them to the emergency room. We'll talk about fever in babies under 3 months of age a little bit later in the podcast, but that's important to know. Ibuprofen can be given if they are over six months of age and over. It's safe after that point. However, it must be avoided before 6 months of age because infant kidneys or babies' kidneys are still developing. And ibuprofen has to be excreted or gotten rid of through the kidneys. So It should not be given in children under 6 months of age. The American Academy of Pediatrics does not routinely recommend alternating Tylenol, or acetaminophen is another name, or ibuprofen. But if families choose, or your pediatrician decides that they want to alternate Tylenol and ibuprofen for children over 6 months of age, you need to write down the dose that you're giving and the time you give it. The reason there's so many issues with giving two medications is because there's a risk of overdose and not remembering when you gave the last medication and which one it was. So it's very important that you write that down, the date and time that that's given to your child. Many over the counter products, if you give them, they have fever reducers in them as well. So a lot of people get confused about acetaminophen and being the same thing as Tylenol. So be very careful when you're given other fever reducers. Also, ibuprofen and Motrin or Advil, those are all the same thing. So it's very important to understand that there are different names for the same type of medication. So you need to always check the labels on what you're giving. Why does a fever in someone who is under 3 months of age matter? Any fever that is 100.4 degrees Fahrenheit or higher in infants under 3 months of age needs immediate evaluation. You need to contact your pediatrician or nurse practitioner or take them to the emergency room due to the risk of sudden or serious infections. These infections could be sepsis, infection throughout the body, meningitis, infections of the meninges or the spinal area, urinary tract infections, and bloodstream infections. That's extremely important if you have a child who's 3 months of age and younger. So, how do we care for our children at home? You want to provide fluids. If they're small, an infant, or are less than a year, you want to offer them breast milk or their formula. If they're greater than 6 months, you can also offer them water, Pedialyte, popsicles, broths, and of course, your older children, you can offer those as well. You want them to rest. You can use a cool mist humidifier. You can suction their nose if it needs to be suctioned out. There's bulb suction that you will be given when your baby is born that you can use, and then warm liquids can help. A lot of people like to use honey because it helps to soothe the cough, and that is perfectly fine if your children are over 1 year of age. However, never give honey to children who are under 1 year of age due to the risk of infant botulism. Those botulism spores can just hide in there and cause lots of problems for babies under 1 year of age. So be very careful with honey, and only give it if your child is over 1 year. Now, let's talk about the over the counter cold and cough medications. Those are not routinely recommended for under 6 years of age due to the increased risk of overdose, sedation, agitation, and breathing issues that come along with those. Many children's cold and flu medications already contain that acetaminophen or that ibuprofen that you may be given separately, and you can overdose them on the medication. So be very, very careful with those. That's why we don't recommend those at the same time. Always check your labels to avoid double dosing of medication. So, how do we treat influenza? Supportive care is the foundation of how we treat influenza. We can do antiviral medication like Tamiflu. It can be considered if the symptoms begin within 48 hours, the child is under 2 years of age because they're at a higher risk with getting the flu, they have chronic conditions, or symptoms that are severe. Testing for the flu is very useful when you're considering antivirals or in severe or unclear cases of what's going on with the child to try to figure out which virus they have or what is happening. Maybe it's not the flu. So we want to make sure before we give an antiviral medication that we give the appropriate medication for the disease that is happening, which would be the flu. Do not use aspirin due to the risk of Rey syndrome. And you might say, well, what is Rey syndrome? Rey syndrome is a very rare but serious condition that can cause liver and brain swelling when it's used during a viral illness. Children and teens should not take aspirin with flu or viral symptoms. So, when do you call your pediatrician or nurse practitioner? Well, we want to call right away. Remember, if your child is less than 3 months of age with a fever, if they have any trouble breathing, they show dehydration, they're not drinking their breast milk or their formula, or if they're older and they're just not wanting to drink, if they've having very poor output or not having very many diapers in 24 hours, we try to have them at least 4 to 5 wet diapers within a 24-hour period. If it's less than that, you need to contact your pediatrician or nurse practitioner. If they're difficult to wake up, they're really lethargic and tired, but they're really hard to wake up, you need to contact your pediatrician or nurse practitioner. If the flu virus seems to worsen after 3 to 4 days, they're not getting better, contact your provider back and let them know. Or if they have chronic conditions, you want to let them know. So, how do we prevent the flu? This is so important. Hand washing is an amazing, amazing thing that we can do. It's very simple, very easy, but it must be done appropriately. You need to wash with soap and water and wash really well and make sure that everyone in the household is washing their hands well. You want to keep your sick kids at home. Cover those little coughs, have them sneeze and cough into that elbow or cough into their hand and wash their hands afterward, cleaning surfaces that they touch. Vaccinating all eligible family members, brothers, sisters, mom, dad, grandparents, uncles, aunts, all the people who would be in contact. And protecting your vulnerable infants, those that can't be vaccinated. The annual flu vaccine is essential because influenza viruses mutate every single year, and last year's vaccine won't protect against this year's strain. That's why we have to get it every year. The vaccine reduces severe illness, hospitalization, and complications. Hand washing, covering coughs, staying home sick, and cleaning surfaces are just so important to prevent the flu. The flu vaccine is recommended for everyone 6 months of age and older. Again, that vaccine reduces those hospitalizations, and for children, it reduces intensive care unit admissions, pneumonia, and the complications like dehydration. It does not cause the flu. And again, as we mentioned, immunity needs to be refreshed every single year. So, how do we protect those babies that are too young for vaccination? Well, one of the ways we can do that is called cocooning. And what does that mean? It means everyone around your baby gets vaccinated. So we protect them with this cocoon around people. Everyone else has been vaccinated, so now we're protecting our little one. Limiting sick contacts. Just see them at another time or ask them to come a different day. Strict hand washing. Again, cleaning those high touch surfaces. Breastfeeding when possible and avoided crowded indoor spaces during peak flu weeks. So, parents, caregivers, and providers, you're doing an incredible job navigating this season. Influenza can feel overwhelming, but knowledge brings confidence, and confidence brings calm. Influenza can be tough, but with good information and supportive care, kids will recover well. Pediatrics is all about partnership, compassion, and walking through each season together. Thank you for joining me on Pediatric Flow with Jolene. Take care of yourselves, take care of each other, and remember, the world needs your compassion, your presence, and your light. So until next time, keep shining.